The content of this podcast is provided for general informational purposes only and is not intended as, nor should it be considered a substitute for professional medical advice. Hello, this is Karen Nickel, family nurse practitioner, and you are listening to Itchy and Bitchy, a podcast that provides answers to your many unanswered health questions. I have so much fun getting to know the people who have enrolled in my course, The Perimenopause Answer, and they have so many good questions for me. This week, one of the women in the course asked me about using low-dose lithium to help with mood. Again, I figured that if she had this question, many of you out there may also have this question. So, guess what? We're talking about lithium today. There has been a stigma that hangs over the medication lithium. This happened for a variety of reasons. It is a medication that many people believe is only for severely ill patients. And also the high doses used to treat patients from the 1960s to the 1980s led to severe side effects and the mistaken belief that it causes kidney damage. Lithium is used as needed to treat mania that is part of bipolar disorder. Mania is a condition in which someone with bipolar disorder displays an over-the-top level of activity or energy or mood or behavior. Dosing of oral lithium that is used for episodic mania is up to 1,500 milligrams a day. This medication can also be used on a daily basis versus as needed to reduce the frequency and severity of manic episodes. The dosing of the med taken orally for this use is up to 1,200 milligrams a day. I want you to remember those numbers, 1,200 milligrams and 1,500 milligrams per day of oral lithium. You may be asking at this point, Karen, why are you talking to us about lithium? I don't have bipolar disorder. Well, for the last few decades, there have been studies to support the use of very low doses of lithium for improved mood and cognitive function. We also have studies on the benefits of using low doses of the med for substance use disorder. A leading functional psychiatrist, Dr. James Greenblatt, states in a Psychiatry Today article that using low and microdose lithium for his patients has been invaluable for helping with irritability, anger, and addiction. In the world of medicine, lithium is not accepted as a nutrient, but based on studies, lithium may be considered a mineral, a type of mineral. If it does have qualities of a mineral, it could explain why microdoses of the medication help people because they may actually be dealing with a lithium deficiency. There are foods that are lithium rich, like nuts, seeds, and legumes. Lithium is also found, wait for it, in drinking water. The amounts vary across the world, and in some regions like North Chile and Argentina, there are very high concentrations of lithium in their groundwater and drinking water. Where your drinking water is coming from also determines the lithium levels. Seawater has 20 to 100 times the content that fresh water has. We actually have a study showing the benefits of lithium just found in drinking water, and I will talk about that after this quick break. Welcome back. What are the benefits we can get from low doses or microdoses of lithium? Based on the review of 14 positive studies evaluating cognition, depression, suicide, and substance use disorder, the strongest evidence for its use is for the prevention of dementia and suicide. Some studies show positive outcomes when using it for depression, substance disorder, and irritability. I have talked about off-label usage of medications in previous episodes. For instance, it was noted that when patients who had a history of migraines started taking beta blockers to treat their high blood pressure, they had fewer migraines. When this benefit was noted, it became common practice to prescribe beta blockers off-label, meaning not its original intended use, for migraines. Lithium has a similar history. The cognitive benefits were first noted in those who were taking lithium for bipolar disorder. Studies to examine the use of lithium to treat Alzheimer's began when studies of those treated with lithium for bipolar disorder experienced a significant reduction in risk for dementia. Some of these clinical trials have found benefits for slowing or halting the progression of cognitive decline with lithium treatment. One double-blind, placebo-controlled clinical trial that included 113 people with a diagnosis of Alzheimer's disease were given 300 micrograms of lithium daily. I asked you to remember that we used 1,200 to 1,500 milligrams of lithium for bipolar disorder. In this trial, they used 300 micrograms, which is the same as 0.3 milligrams, under 1 milligram, which is a microdose of the medication. The trial lasted 15 months, and the participants had an average mini-mental status exam score of 20 out of 30 points. When the study ended, those who were taking lithium had mini-mental status exam scores that remained the same at the end of the trial, the same as the beginning numbers. In other words, no decline. While those who were taking the placebo continued to decline and had an average MMSE score of 14 out of 30 at the end of the study. A 2020 review of multiple studies looked at almost 6,500 people with bipolar disorder who were treated with prescription lithium at prescription lithium doses of 1,200 to 1,500 milligrams a day. They compared those treated with lithium to 43,000 people who were not on lithium treatment, and they found that lithium treatment reduced dementia risk in the bipolar patients by 49%. A 2011 trial for low-dose lithium for cognitive decline also found that the patients on placebo worsened, whereas the patients on low-dose lithium remained mostly stable. They did a final analysis of the patients in this study in 2024. Of course, many of those in the study had passed away between 2011 and 2024, but the surviving study participants who received lithium had higher memory scores than those who were given a placebo, and the difference was significant. Those on lithium had an average score of 25.5 out of 30 versus 18.3 out of 30 for the placebo group. Those on lithium also had a much higher verbal fluency score compared to the placebo group. We are seeing a rise in Alzheimer's disease and dementia, and it is projected that those numbers will continue to increase. Lithium treatment could be something to consider using in addition to our current available treatments for Alzheimer's and dementia. Earlier, I mentioned that lithium is in our drinking water in varying concentrations depending on where we live. Well, in 1970, it was noted that in one area of the country where the lithium levels increased in the groundwater, the levels in the tap water increased. As the lithium levels increased in the drinking water, the number of admissions to a state mental hospital in that area decreased. Since that discovery, researchers have been studying the relationship between lithium levels in drinking water and mental health outcomes, especially the suicide rates. In 2021, a meta-analysis of the data gathered over these decades was completed. The review included 113 million people in almost 2,700 regions across the globe. The study found that the areas that have higher levels of lithium in the groundwater have fewer suicides and fewer admissions to mental health facilities. The number of suicides in this country continue to rise. Low-dose lithium could be considered as a safe addition to our current approaches for suicide prevention. I want to take a moment here and remind everyone that if you or someone you know is having thoughts of suicide or are going through a mental health or substance use crisis or under emotional distress, please call or text 988 or chat online at 988lifeline.org. 988. We also have studies showing the benefit of using low-dose lithium for those with major depressive disorder who have not responded to treatment with SSRIs like Zoloft and SNRIs like Effexor. Significant benefits in reduction of depression symptoms were seen using 300 to 400 milligram daily doses. Now, this dose is low compared to the doses of up to 1,200 milligrams daily that I mentioned earlier that we use for bipolar disorder, but these lower doses are way higher than the microdoses of 5 milligrams and less that were used in other studies. Substance use disorder is often very difficult to treat, and clinical trials for meds to treat the condition are difficult to complete due to the high number of people in the study who drop out. As a result, it is hard to collect and interpret data for those with this condition. That being said, the participants in studies using 150 milligrams of lithium avoided hospitalizations for alcohol use and showed resolution of manic symptoms. Participants on 150 milligrams of lithium in one study had a 50% decrease in opiate use, a 99% decrease in benzodiazepine use, a 70% decrease in need for atypical antipsychotic meds, and use of multiple illicit drugs decreased by 79%. On top of that, the rates of program completion increased by almost 100%. Microdosing of a form called lithium orotate can provide benefit for irritability. In Dr. Greenblatt's clinical experience, he states that for his patients, quote, struggling with irritability, especially when there's a family history of addiction, bipolar disorder, or depression, elemental lithium between 2 and 10 milligrams, typically as lithium orotate, has provided significant relief, end quote. Microdoses of lithium are available over the counter. These products are not regulated by the FDA, so if you take an over-the-counter lithium supplement, it is important to choose a product that has been third-party tested to ensure that it has the strength listed on the label, that it is free of specific contaminants, and that the product breaks down well so your body can use it. There are 3 lithium supplements that are approved and are top picks by Consumer Labs, a third-party testing company. 2 of them are 5 milligram capsules, Swanson's lithium orotate 5 milligram capsule and Solaray's lithium aspartate 5 milligram capsule. A lower dose option that contains 1,000 micrograms, which is 1 milligram, of lithium orotate is Life Extension's Memory Protect capsules. It is believed that the form of lithium orotate, which is contained in the Swanson and Life Extension products, has better absorption with fewer potential side effects compared to the form of lithium aspartate that is in the Solaray product. However, both are effective to help with mood and cognitive function. Even with these very low doses of lithium, there can be some risks involved in taking it. Be aware that taking too much of any form of lithium can cause toxicity, so more isn't necessarily better. Symptoms of toxicity include lethargy, vomiting, difficulty with balance, and muscle tremors. Long-term use of a moderate dose of lithium can affect your thyroid function, and high doses, like we use in bipolar disorder, have been linked to kidney problems. Although lithium is not officially considered a micronutrient, some experts argue that lithium should be recognized as a trace element given the evidence of anti-suicidal and neuroprotective effects even when using microdoses. Using an integrative medicine approach, microdoses of lithium may act like a nutrient supplement that can improve mood, reduce irritability, and support cognitive function. Thank you so much for listening. Wherever you listen to this podcast, please leave a review and rate the podcast. Your reviews and ratings matter. They matter to the podcast and they matter to me. Also, make sure you follow the show so that it will be automatically downloaded. That's super important. I encourage you to visit our Facebook page, IMB Podcast, where you can give us a like and leave comments or questions for me. Our website is itchyandbitchy.com, where there are blogs with some of our subjects available for you to read. As always, thanks to Forrest Wenzel, my son, our producer and composer of our theme music, and the person who does all the behind-the-scenes work to make this podcast possible. Thank you, Forrest. Forrest is deep into his first semester of his second year of his master's degree in music composition at Peabody Music Conservatory and is really loving it. So proud of him. Remember that your health is in your hands.